Alrighty, hello everybody. Mike Manna here for our first live episode of 2026. This is going to be the last time I say this. Happy New Year. I'm tired of saying it. So welcome back. We have a couple of very special guests. Both of them have been here before, and they are one of our national sponsors. And before I get directly into their introductions, what makes this special, whole person virtual care, we have David Huerta. I'm practicing saying his name.
You did good, Mike.
Thank you. I rolled that E. Who is the CEO of the company and my best friend in life and mentor and trusted person, Leanne Bonatti, who came out of retirement to do this. But before I get heavily into that, what makes this one of our special episodes is every guest we have, everything on the new website, everything we do on 62 Who Knew is preparing people for retirement. Our average audience is between 45 and 90, and everything is long-term care, annuities, da-da-da-da. And it's great. We've grown. We're one of the largest retirement platforms in the country right now. That's not so for whole person virtual care. This is for everyone. This is for the 20-year-old. This is for the single mom, the single dad, the people with insurance, the tens of millions of people without insurance. This is a life changer across the whole spectrum for people and their families. And Leanne's going to give some great examples. I finally have a great example to give, but Leanne has some very touching examples from her family. So this is a special one. And welcome back, David. And we thank you for bringing whole person virtual care, not just to 62 Who Knew and its viewers, but bringing it into my life. It's a life changer.
Thank you for having me, Michael. It's always an honor to work with you and your team. And we look forward to getting the message out to as many folks as possible. Like you said, whether you're 20 or whether you're 92, this message is for everybody. And I look forward to this discussion.
Absolutely. Let me give you a little background on David. And I say a little because his resume is quite extensive and quite impressive. But let me tell you about the CEO of this company, a visionary leader and respected expert in the employee benefits field, renowned for transforming delivery systems to improve client outcomes. There's nothing more important than client outcomes in the medical world or in any industry. David is recognized for his innovative approach to health plan management and his commitment to educating industry leaders on the healthcare system reform. And today we're going to be educating our, I hope, 15 or 20,000 people that are listening. We're going to take your message directly to the public, although we are going to talk a little bit about groups too. We didn't do that the first time we were on, and we're going to do that a little too. And also joining right to my left, live in the studio, is Miss Leanne Bonatti. I won't say how long we're friends because that'll
make us old.
That'll make us old, yes, yeah. We met by wagon train. It was really amazing that we ran into each other on the prairie like that. But be that as it may, many of you know Leanne's name, specifically in Florida, but all over the country as well. Leanne and her family were the founders of By Owner, the largest for sale by owner real estate company in the country. Leanne sold that company
on the day my triplets were born.
Oh my God.
June 1st of 2000.
I bet it's June 1st.
Yep. Just a little, a little more than 20 years ago.
Yep.
And quite frankly, has been a full-time mom. I mean, done some investing and other stuff, but a full-time mom, which with triplets, that's much harder than running By Owner.
Oh my goodness.
It's much harder than being the CEO of Whole Person Virtual, being the mom of triplets, but has literally come out of retirement when she heard
Without
her
question.
friend, her old friend, David, had gotten into this and what it is. And you have some touching stories to tell about it. But first, David, a little bit of your background, which I've already summarized, but how you got into this. And I know for you, it's a mission. It's not just an entrepreneurial thing. It's in your heart, which I think is incredible as well. Tell us a little about that.
Well, thank you for asking, Mike. Yes, I was, as you nicely stated, was in the benefits world for over 30 years and created the delivery model to compete against the insurance carriers because of all of the conflicts of interest. And our model was very pure and transparent and improved outcomes for employees and their spouses and helped our clients who were employers to improve their financials as well because of how we reduce their claim costs. And that's not being anything but positive, reducing claim costs using this model because of what it does for the employees. My company was acquired by a national firm. I retired in 2022, so Leanne and I are very similar that way, and we came out of retirement. But how I came out of retirement, Mike, is I played a lot of pickleball, and you can only play so much. And I realized that there was still a pressing issue for people. And that pressing issue were two things. Number one, the inability to get in to see their doctor when they need it, the delay in getting an appointment with their primary care doctor, and then also costs associated with care. And costs associated for individuals are the cost of their plan, premium, the cost of their deductible, the cost of their co-payments that continue to go up. And now even more to compound that, Mike, is the fact that people that have individual plans through the exchange, they're losing their subsidies. Maybe they'll get some of it back. I don't know, but there's going to be huge expenses. And I'm tired of seeing newspaper print and even on news, talking the negative, which it is negative, but they don't want to talk to me. We have a solution for these folks, a very positive solution for $250 a year. And why they think I'm advertising? No, you're providing a solution to your constituents. Please spend time with me. But, realizing that there was still an issue that's now compounded more than ever. And then also knowing that in the model that was created to compete against the insurance carriers, we provided this access to the virtual medical practice that Whole Person is about. And so I contracted with the two co-founders, two medical providers and ER medical providers to be their national marketing arm, to bring this out to people. And that was about a year and a half ago. It takes that long to build a company, and our company is now fully functional with all of the pieces in place. We're growing. January 1 enrollments were incredible. And so, Mike, I've surrounded myself with a team of people in leadership capacities at Whole Person. Our CFO, Kent McClellan, has been a user of the plan through his company since 2013. Sarah Greenberg, my COO, has been involved with the company for a year and a half and very instrumental in making things happen. My Chief Growth Officer, Christine Huerta, my sister, came out of retirement as well. She's a retired nurse anesthetist, and so on and so on. And we're very passionate about bringing this out to people and really appreciate the compassion that you have for your constituents and your listeners. And it is a true solution. I'd love to go over some statistics when timing is right.
We're going to. And before Leanne, before I hand it over to you, because you did what all brilliant people do. You said, I'm going to use this thing before I come out of retirement and lend my name, which is quite nationally known for credibility, to it. So you have some stories to tell that I think are, they're touching, but they're also very factual. People, with the things that you're going to talk about with your nephew and your children and yourself,
myself,
is what our viewers go through every day. And you mentioned something that we didn't mention too much of the first time, and we're going to be a little more blunt this time, but the $250 total cost for you and your entire family. Most people look at that and go, well, that's where I tune off. That's too good to be true. Yet it is true. And we're going to get into that a little more towards the end of the show, because I did some statistics. David doesn't know this about the top 5 virtual healthcare platforms like this, although there is nothing like this. In fact, I see a lot of people calling it anytime healthcare. I just learned that this week. And I did a deep dive into these. And these are names that people know more than they know Whole Person Virtual Care. This is MD Live, Doctor on Demand, Teledoc. These are words that everybody knows. And when I'm going to do a quick, direct comparison towards the middle of the end of the show that is going to blow our audience away. There is no comparison between, I'd say they're our competition, but they're not.
They're not, yeah.
But
That's right.
Leanne, tell a little bit about why you decided to do this, and then give a couple of your examples, because you're using the hell out of this program.
I am. They're losing money on me.
Yeah,
no question.
Leanne is in the high roller room in Vegas, breaking the bank. They are not making money on Leanne Bonatti and her family, but go ahead.
So First of all, David sold a couple of properties through our company by owner years and years ago, which is how we end up knowing each other. And to come full circle and have the opportunity to work with him and get on board with something that he's so excited and passionate about, I caught the bug. I felt like it was too good to be true, but it's life-changing. It really is life-changing. So the first example I have about this particular, about whole person is my nephew. I didn't realize my nephew, who's I'm crazy about, that he had aged out of my brother's healthcare plan at 26. My kids aren't that age yet. My kids are 20, and I didn't realize that. And he has had high blood pressure, and he's been on 2 medicines since he was like 18 years old, unfortunately. So I was talking to Trey about this, and he, said, I have to go to a walk-in clinic, TT, when I need some, care, when I have to get my medicine, I have to go to a walk-in clinic, and it costs me $100 or $150 each time. I said, you're kidding me. So I took out my credit card, and I said, Trey, we're doing this now. And we literally sat in my kitchen and enrolled him. And also, in addition to the incredible speed of him getting his 2 prescriptions, which happened in 1 hour and 11 minutes, he received a text from Walgreens saying, Mr. Bonatti, your prescriptions are ready. He was blown away. He said, TT, you've given me a lot of things in my life. This is going to be the most valuable, the best gift you've ever given me. I get goosebumps thinking about it. He also has been going through some things. He's a licensed real estate agent. He's been having, some emotional issues, let's say. And he used the mental health part of this program, which again is another piece that it sounds too good to be true. I happened to be sitting there with him. Within 3 or 4 minutes, the mental health person called and immediately wanted to know whether he was in crisis or not. So the response was compassionate. This girl was so good with him on the phone. They spent 5 or 6 minutes talking and then scheduled an appointment, for later, because it wasn't a crisis. And he's had several appointments since then, with his subscription that just is mind-boggling. That again, for $250, and he's a standalone. It's his subscription, but he's using it, and it's truly unbelievable. So that's the first. But
there's more.
Time. There's more.
Oh, but there's more.
Just recently, I happened to have been in Los Angeles for that awful Buccaneer game. I think the worst Buccaneer game ever.
Well, no, they have a lot of worse games. Worst one this year.
This one was, oh man, to be in those stands during that game was just horrifying. Anyway, we're back in the hotel after the game, and I said to my daughter, Gabby, do you see anything in my eye? And she goes, ooh, Mom, you got goop in your eye. And I'm like, oh, no. And we were getting ready to leave for Europe for Thanksgiving. So I picked up my cell phone, I hit the button, I hit the app, and I was on the phone with a practitioner from my hotel in Los Angeles, took a photo of my eye, sent it in, and the practitioner said to me, do you want me to call your prescription into the Walgreens on Dale Mabry? I said, no, I need you to call it into the CVS on Royal Point Sienna Drive because I'm in LA and I need to go get it. I was in my Uber 45 minutes later with my little bottle, and before we ever hit Madrid, my pink eye was gone. I mean, it's the same thing happened 3 times. I've used this program, and they've actually called the medication in for me somewhere I don't live. Fort Lauderdale once, Boston once, and this time in Los Angeles. It repeatedly has worked for me and has worked for my family. My daughter had a sinus infection. My son was wrestling
and they're away in college.
They're away in college. Yes, 20-year-old triplets.
Big.
They're away in college, and the fact that we know that they've got access to an emergency room technician or a practitioner 24 hours a day, 7 days a week, because the college medical offices are not open when they need to be open.
Right. They're
it's
open
ridiculous.
9 to 5.
Yeah, they're not available. So knowing that our kids have the ability to tap this when they need it is, as a mom of college students, is a great peace of mind.
And again, I just want to blurt in, if any of you work or are aware or are influential in your children's colleges, you know what Leanne just said. When your child needs something, and child 20 years old, at 2 a.m, the infirmary isn't open. They are either going to an urgent care, not for $100, but for $200, $300, $400. They're going to sit in the lobby and catch whatever they're going to catch in the lobby, which is 10 times worse of why they came, or they push a button and they are going to CVS or Walgreens 15 minutes. So if any of our viewers know or are influential with any type of education facilities that you think would be interested in this for their student body, please contact M. Banner at 62whoknew.com. You can do that directly. You can do it through www.62whoknew.com. You can do it anyway. But that's very important because I see this in colleges as life-changing for parents.
Yep, absolutely.
For the children are, yeah, sure, we'll go. We'll put the emergency room visit on mom's credit card. That's what our children would do.
That's right.
But this is incredible. For millions of Americans, the greatest asset they own is their home. Yet most of that equity sits locked away, unused. What if there was a way to unlock your home's value without debt, without interest, and without monthly payments? Introducing Chiefs, converting home equity into financial success. A revolutionary strategy that lets you turn a small piece of your home's equity into cash you can use today to protect your retirement tomorrow. Visit 62whoknew.com to learn how Chiefs can fund long-term care, annuities, life insurance, or lifestyle goals. Whether you're purchasing a new home or refinancing the one you love, one thing has never changed. Mortgages remain the most inexpensive cost of funds available. And in today's market, choosing the right mortgage professional can save you thousands and help secure your financial future. That's why the 62 Who Knew podcast partners with American Pacific Mortgage, one of the nation's most respected lenders, helping homeowners make smart decisions at every stage of life. Visit 62whoknew.com to learn how the right mortgage strategy can power your retirement plan.
What I wanted real quick to say, back when we were running by owner and had a couple of hundred employees, my last year owning that 20 years ago, we paid as a company over $300,000 as our contribution to the health programs that we had for health insurance for our people. My God, what I would have done to have had this
$250
then,
a year,
because it cuts down on the expensive utilization if there's insurance. So I would love to have had this.
Yeah, and I want to go to the national expert in that utilization and membership field, back to David, because again, to those companies that are participating with their thousands, sometimes hundreds, sometimes thousands, sometimes tens of thousands of employees, and paying a portion of their medical premiums that go up year after year, by offering this program directly through their paycheck, through their payroll, their utilization of their medical program is going to go greatly down. You have statistics to prove that. That means their premiums are going to go down. So let's talk about this for the massive employer, for the college, in a group way. Yes, it's $250 for a single person, but we can do this with large groups, and they can take $20 or $25 a month out of their paycheck, which they'll never miss, and have this service for the rest of their life, and yet save their employer, I know I'm not exaggerating, hundreds and hundreds of thousands of dollars in premiums. So delve into that a little for us, David.
I'd love to. Leanne, I always love hearing your stories. And I want to comment on something. Michael, you said it, Leanne proved it. You said that she's very expensive because of the utilization, right? Now, if we were an insurance company where we paid claims, yes, she would be very expensive because the fee-for-service claims that come in for each of those visits are expensive, and I have info on that. But it's very important, listeners, please know this. Leanne and her family are not a huge expense to the program at all. And here's the reason why, and this is a big differentiator. Number one is the doctors that participate with the program are paid hourly and take shifts. Okay, so we have a fixed cost basis, or the practice has a fixed cost basis with that. If they're paid per call, then they're paid per call, which is significantly lower than the cost of a claim. Right, Michael?
Yeah, absolutely.
Yeah, so when you become a member, folks, listen, it's so easy. When you pull up the app, there's 4 ways that you can use it. Number 1 is, I need help now, right? It's called urgent and acute care. Maybe some small emergency care, but if you have a true medical emergency, get to the hospital. But you say, I need help now, or entry B is, I want to make a primary care office visit appointment. Entry 3, I need a mental health visit. Entry 4, I need a refill. It's very easy, and it doesn't take rocket scientists to figure out how to use the plan. Last night, Sarah had an issue with a ruptured capillary in her eye. This was at 10:30 at night. She pulled up the app, entered the information. It took her 4 or 5 minutes to get the specific information in about the blood in her eye. I think it was 12 or 13 minutes later, she was getting a call back from an emergency room trained provider. You are not without care with this program, whether you have insurance or not.
That's right.
You have help when needed. Okay, Mike, you wanted me to talk about some data on the commercial side. So commercial side, everybody, means the employer side. So if any of you are employed and offered health insurance through your employer, please listen, because this is very important and could be very helpful not only to you, but to all of your coworkers as well as to your employer. And it could benefit your employer significantly in a lot of ways. And I'll touch base with 2 quick ones. Number 1, it makes the employees happier, because if they provide this to the employees for a reduced fee on a commercial basis, employees are just going to love this plan because of the ease and access. And oh, by the way, when you use it, it's $0 cost basis. It's a $0 copay to get rid of any affordability fear. Okay. There's no surprise bills that come in either. This is strictly professional healthcare delivered the way it should be in 2026. The employer gets happier employees. They get healthier employees. And depending on the type of insurance you're offered through your employer, it's going to have significant improvements there as well, especially if they're self-insured with reduced costs. So I would love and honor an opportunity with Michael and Leanne to talk with any of your employers that are out there. So folks, this is recent data. I'm talking less than 30 days old. So a 3-year national survey was done by an insurance carrier or insurance firm called USI. They're top 5 in the country, very, very big, very, very reputable. And what their survey showed, and you may fall into this, less than 30% of people that have health insurance coverage through their employer, less than 30% use a primary care physician. And personally, I have to wonder, and I'm pretty certain I'm correct on this, the reason that number is so low is because of access to care. They can't get in to see their provider when they need it. And number 2, cost. What do I mean by cost? I mean their copayment, their deductible. So you're withholding care. So barriers to care is the term I use. Barriers to care are removed with this. So less than 30% of the people covered by a health insurance plan by their employer use a primary care doctor. 18% use the preventative care services, which is really crazy to me, because a healthcare reform states that preventative care services have to be covered at 100%, meaning zero cost to the person who's getting the preventative care. But only 18% use that. Again, you have to wonder why that number is so low. So in those 2 statistics alone, Michael and Leanne, you have to say, okay, where are these people going otherwise? They're going to an urgent care when they're really sick, or they're going to the emergency room. Okay, that's great, but they have a high deductible, they have high costs associated with that, and look at the cost. So this survey identified that the price of admission to get into a primary care doctor, this is the retail charges now that doctors charge. And yes, with an insurance carrier, you get a little bit of a discount on that, or you have a copayment. Primary care office visit, $200. The price of admission to get into an urgent care is approaching $2,000, one visit. The average price of admission to get into an emergency room is over $4,000. And the price of emergency rooms continue to go up and will not stop going up. And this is what I spoke on for years with my cost plus delivery model. There are no rules or regulations at the state or federal level that limit what hospitals can charge for emergency rooms. They charge what they can because they can. So folks, having the whole person program, this goes away. You have immediate access to urgent and acute care situations within 30 minutes of providers calling you back, like it did with Leanne, like they did with Sarah, like they've done for me since 2013 when I first started using them as my practice. It's absolutely amazing. So keep these numbers in mind. The next slide is a people slide. So Benefit Hub is located in Tampa, Florida. and they provide incredible pricing for certain things. They increase the buying power for employees, whether it's buying movie tickets or plane tickets, luggage, cars, restaurants. Benefit Hub does an incredible job building value with purchasing. And so they did a survey to all of their clients, who include 80% of the Fortune 100 companies. So we're talking Amazon, Dell, Home Depot, all of these large companies, Johnson & Johnson. So of the 40+ thousand respondents that came in, the two top concerns that employees have today: the economy, that's a no-brainer. Number two, the affordability of healthcare in premium and cost to use their medical plan. So people are afraid to use the plan because of expenses. And when they want to use the plan, they can't get in to see their doctor timely. And if they have to go to the urgent care, Mike, like you said earlier, you're going to go into an urgent care center that's loaded in a waiting room that has a lot of sick people. So who knows what you're going to get when you get out of there. All right, now, folks, these are scary facts, and we're not here to scare you. We're here to provide you a really friendly solution. And I'd like you to see some statistics from utilization of the platform. So who uses the plan? Mike, you alluded to this earlier. Whole person is for everybody. Under 30, on an analysis of over 5,400 employees that are using the program, it's 5 groups. And of all the calls that came in for this block that we looked at, 36% were under the age of 30. 36%, huge. What does that say? Mike, it says you're increasing your market base now because people under 30 should be listening to you, right? So under 30, 36%, 30 to 39, there's a typo, sorry about that, 27%. And you can see 40 to 49, 18% of the calls, over 50, 19% of the calls. So this is used by people of all ages, especially the younger ones who have no fear of using the phone to get virtual care. And folks, you should not have any fear of getting virtual care with whole person virtual care. Why? Because you're talking to an actual provider. These are people you're talking to. It's not AI, and you're going to get the care. By the way, when you use the app, 96% of the time, that first reach out that you make, you're going to be diagnosed and treated 96% of the time. So who uses the plan? By sex. Females use it 68% of the time. Male uses it 32% of the time. What does this tell me, Mike and Leanne? What this tells me is women use the plan a lot, and it may not only be for them, because women are typically taking care of the kids. So females are using the plan a lot more, the program a lot more, because they're using it for themselves and they're calling or using it for their children, right? So that's why we see there's such a big delta between that statistic. Now, folks, the next image you're going to see is a statistic on when the plan is used. Okay, and
This
I want
is
you
huge to me.
Yeah, huge, right, Michael? Leanne, this is crazy. So of all of the calls that came in, all right, I looked at the data. All of the calls that came in, after hours utilization was huge. So between 9 p.m. and 6 a.m. in the morning, 23% of the calls came in on over 5,400 people. What does that tell me? What does it tell you? It says, yes, people need the plan all of the time. Your child wakes up at 2 o'clock in the morning coughing, or there's an issue with an earache, or whatever the issue is. 23% of the calls come in between 9 and 6 a.m. So, Mike, anytime, right? That anytime doc thing, nobody takes care of the patients the way that these providers do after hours. And for those of you that are listening and thinking about your employers, this is an important statistic for your employer. Why? Because if did not have this program and you went to the emergency room in the middle of the night, you're not going to be on point the next day at work. You may be calling in late. And if your employer's self-insured, guess what this plan just did for them? Remember that statistic a few minutes ago where the entry point to get into the emergency room is $4,000?
Yep.
Well, yes, your employer would have paid that if you were self-employed. You just saved your employer $4,000. So for every visit that's avoided to go to the emergency room. The last statistic is very important. And again, What this simply shares, Mike and Leanne, is the fact that for every employee that's covered, or for every member that buys an individual membership for themselves, they're covering dependents, whether it's a spouse or whether they're covering multiple children like Leanne has her triplets. It's an incredible tool. It makes care, this truly makes care accessible and affordable, and you have the confidence and comfort of knowing there's a doc in your back pocket, Michael.
I think, Leanne, I think you said it when you were first describing this to me before I even met David. It's like having a best friend,
Yep, that's
an
right.
ER technician
That's
as a
right.
best friend. And I want to say something about that because people think that I mention it too much. But when I talk about this, because I talk about it a lot when I'm not in front of a camera, let's talk about the people that
The level of medical, yeah.
These are ER practitioners. And again, what's the big deal? I'm not
Michael,
dying
hold
in a
on.
car. God,
Just let me clarify that. So remember, there's 3 entry points for care, Michael, right? You have the urgent acute side, primary care, and then mental health care.
right,
Okay. 93% of the calls come in are on the urgent acute side.
right.
In order to qualify to provide professional services for urgent acute care, you have to be an emergency room trained provider. Okay. So if Dr. David was a general practitioner, I don't qualify to take calls on the urgent acute side. Okay, so you're absolutely right on the urgent acute side. On the primary care side, it's general practitioners, family practitioners, and stuff like that. Even on the urgent acute side, Michael, even the members of the team, because folks, when you go into an emergency room in person, it's a whole team of people. It's a team approach to solving your care. You get that same team virtually, so they're all ER trained, Mike. I just wanted to clarify so that it's not a statement.
I'm glad you did because let's talk about Dr. David, the general practitioner. Probably a great doctor, but
Right.
ER people that work in the ER, they take care of your pink eye.
Everything.
They take care of your children's stuffed nose. They take care of single gunshot wounds. They take care of heart attacks and strokes. It is a special class of people that work in the ER. And, for a generation like me that was brought up watching, medical shows that I know are not reality, which way, by the way, my favorite one now is The Pit. Have you ever watched The Pit?
Yeah.
Oh my God. But anyway, you are getting that level of care. Not that I want any of our viewers calling up with a single gunshot wound. Do not go to an emergency room. But I find that very comforting. I know when I go to an emergency room, which as I've gotten older has become a little more frequent, I feel better walking through the door knowing that whether it's my asthma or a heart attack, which I've never had, but when I can't breathe well, that everybody's there, to get the right problem done. The other thing I want to stress to our viewers, which is kind of important about the whole topic, is that the growth in the popularity of this type of care, of virtual care, or what I've learned to be called as anytime healthcare. This growth didn't come from Hollywood spokesman. This growth came from pure driven by demand.
Right.
America, probably the rest of the world too, but America demanded this. We are an immediate satisfaction world, but especially this country. We want immediate satisfaction. That's the the beauty and the curse of this immediate satisfaction. So this has grown by demand, and I did some work since your last visit with us because it also had a very big help to me and my daughter and I on a personal level. Yeah, I did some work, but I did the top 6, what we would call competition for whole person virtual care, which they're not
there is no
competition.
competition.
But that's what, if you Google that's what you would Google, or I'm addicted to AI. Who's the competition for a whole person? First we have Teladoc, which is really a company that's on the tip of everybody's tongue for the last 10 years. Incredible company, pioneer has to be of this. Next is Amwell, which comes as short for American Well. The next one, which I'm familiar with, MD Live. The next one is Doctor on Demand. And the next one is HealthTap. Now, I did research into these companies. They are absolutely great companies. But You are not talking to an ER practitioner when you're on the phone. You are not guaranteed to get a call back in less than 30 minutes. And I hate to bring money into it, but you talk health in this country, you got to talk money. This is specific figures from these 5 companies. The average cost of these companies is $235 per encounter,
Yep.
per call. And you're $250 a year with no deductibles.
No payments whatsoever.
No payments
Every
whatsoever.
time.
And 3 of these companies, if you do want mental health care, that's extra.
Right.
That's, again, it sounds too good to be true. But in this particular case, it's not too good to be true. This is incredible first-class, immediate health care.
Michael, and those vendors that you just discussed, a lot of them are only available on the commercial side through employers. Okay. And it truly is up to the employer to engage that teleprogram at a certain level. So some employers are actually spending money to buy the cost basis down a little bit for employees to have co-payments. So again, this will protect you. So
Yeah.
they're all different, okay, and they all do a different job. But you're absolutely right. Whole Person provides a fully integrated one-stop virtual medical practice for $0 copay, unlimited calls. It doesn't get any better than that, right, Michael?
No, it just can't.
Are you turning 65? Well, if so, the most important decision in your life right now is to determine which Medicare plan you need to be on for your unique changes in life. Are you still working? You on your employer's plan? How about being a snowbird? If so, you need to speak to a Medicare consultant who can help you with your needs. I'm Diane Daniels, and I'm the CEO of Medicare Nation. Go to www.62whoknew.com and click on the Medicare Nation tab. I will give you a free consultation to make sure we find the right plan for your unique needs.
What's the biggest threat to your retirement savings? It's not the stock market. It's the cost of long-term care. Home care, assisted living, or nursing facilities can drain your life savings in just a few years. That's why long-term care insurance isn't a luxury, it's a necessity. It protects your assets, preserves your independence, and gives your family peace of mind. Don't leave your future to chance. Visit 62whoknew.com and start planning the retirement you deserve. I try to make the podcast, no matter who our guests are, educational. And yes, the website is here to show you how to take advantage of what we're discussing, whether it be long-term care insurance or annuities or final expense insurance, whatever we're discussing. I'm going to be I don't want to be salesman-y when I'm hosting 62 Who Knew, but I'm going to be a little salesman-y with this. Go to 62whoknew.com, click on the Whole Person icon, learn about this company, get it for yourself, get it for your children, recommend it to your employer, recommend it to your best friends. It'll be the greatest gift you gave them, like your nephew said to you.
Yeah.
I mean,
Yeah.
I bought it for 4 first cousins. I bought it for my mother-in-law and for two other nephews. Paid for it personally for them for Christmas because I believe so much in what the opportunity that this gives people that I love, even and people that I don't know, the ability to, no matter when they need help, they can talk to somebody who is qualified, and 96% of the time will actually diagnose and treat and take care of that for them. And I felt that strongly that was what we wanted to give as gifts because it's the best possible thing to do. And all these millions of people in the country right now that are losing or cannot afford to have their health care because of the subsidies going away, at least knowing that you can speak to an ER trained medical person 24 hours a day, 7 days a week, no matter what. Doesn't matter whether you have insurance or not.
That's
you have
right.
access to somebody who can give you the proper information that you need to get the treatment that you need.
Yeah.
That's invaluable. And it's for $250, it's insanity.
that's the best gift you could have given those people.
Truly.
And, every now and then, it's very rare but every now and then, at least in my lifetime, something comes along that changes the landscape of the country. I mean, it's not usually a great sales product. It's not usually a great car or a cheap car. It could be let's face it, 50 years ago, the advent of chemo that started curing cancer. Oh my God, that was impossible 50 years ago. Then came radiation. Now we have immunotherapy. Many people are not used to that, but we'll bring on a scientist to talk about that. 90% of certain men's and women's cancers right now in this country are curable. Certain things change the landscape of America. And quite frankly, I'm not being biased about this. I know I'm not. I'm being emotional, but not biased. Whole person can change the landscape of healthcare in this country. Just, very proud to be a part of it, very proud to know David. So glad you brought me to it. I told this story the first time a few of us were coming out of the movie theater. You told me about this great thing, and you're coming out of retirement, and you started talking to me about concierge medical care, and I'm thinking to myself, I really can't afford that. And then you went, and it's $250, and you remember what I said?
I do.
Yeah, go ahead, say it.
You're like, it's only $250 a month?
I'll take that. I can afford that. And she went, no, a year. And I said, well, what's the deductible? Nothing. Oh, I got to learn more about this. And then we met David I met David a few days ago. I don't know what else to leave our.
One more thing I think is important, because there's comfort in numbers, right? There are over 5 million people utilizing this program. This is not new.
That's right.
This care from these ER practitioners is not new. There's 5 million people using it. So you have the ability to join this huge group of people, which is one of the reasons why the price is so good.
Yes.
And take advantage of that opportunity. So it's not like you're the 12th person who'd be using this.
Well,
there's millions of people.
Yeah. And again, I can't stress enough, go to the website, 62whoknew.com. David, we're going to give you almost last words. I always get the last words, so you'll get the almost last words. Click on the whole person link. Learn about this company. Their website is staggering. I mean, we're giving good information, but go look at the website where you go to from ours. Always remember to like and share and subscribe to 62 Who Knew as we grow by the thousands. David, final thoughts of not just the company, but again, what's most, I won't say most impressive, but what I think is incredible about you is so much of this comes from the heart. It's not necessarily the $250 or the $22 or the this or the that. This is truly has been, since Keith created the company, a mission of the heart. And I think that's actually how most great things start. That's how cancer was cured. That's how many things started, not necessarily for the almighty dollar, but actually from in here. And I think the fact that mentality, engulfs whole person virtual care is something that attracts people to it.
Mike, thank you for saying that. And it's true. It's compassion for people. We're all servants of God, and you got to care for others. And this is a very easy way to care for others. Just bring them the healthcare and professional healthcare services that they need. And,
when they need it, and without having to pay for it on the spot.
Right.
Yeah.
Exactly. It's healthcare delivered simply, affordably, and timely. And Leanne, I'm so glad you brought up the 5 million patients, and because it's just, there's so much to talk about. The other bullet next to that, Leanne, is 95% patient satisfaction, right?
That's right.
Well,
And
yeah.
so
I'm 105% satisfied. I don't know how.
My father used
12,000%. I'm happy.
You know how close I was with my father, and you knew my father
Yes,
for
of
30
course.
years. And one of his favorite things, it was always, I believe in that 110%. And when I was like 12, I would go, Dad, there's no such thing as 110%. You can't go above 100. But now I say that, and you just said it.
Yeah.
Well,
it drives the point home of the believability, if you will, or the conviction.
Yeah. Well, it does. And again, statistics are not always the most emotional, heartfelt thing. But think about these and correct me if I'm not saying it correctly, but 93% of the calls are urgent and taken over by a ER practitioner. 96% of the calls are solved
On the first call.
on the first call. And what was the one you just said? Another
95
90-something percent. Go ahead.
95% satisfaction.
95% satisfaction. Who can say that about anything? Well, let's forget medical. There's not 95% satisfaction with anything.
Right.
With your favorite car, your favorite movie, your favorite food, your favorite restaurant, your favorite TV, your favorite electronic. This is incredible. And the fact that that 95% satisfaction, again, is from a pool of 5 million, not
Right.
37 people that we all know.
Right.
Okay. It is just, I know I use the word too much, it's staggering. And where I hope 62 Who Knew can play a small part in bringing this to America. David, final thoughts?
Yeah, Michael, final thoughts are, going to 62 Who Knew, you'll see a QR code as well. Michael has done something very special for his listeners. Clicking on that QR code, there's a 5% discount to the 250, Michael. So,
Okay.
it's a $237.50 cost to you. And you can't beat the value in that at all.
The first time you call, you're ahead of the game. That's what,
Yes.
based on these statistics, the first time you call, you are ahead of the game.
And it includes it includes the parents or the husband, wife, whatever the combination might be. It also includes children up to the age of 26. So, whether they're home or not. My kids are 20. They're away at college and they're covered. They've got this incredible service available to them. So it's the entire family for $237.50.
Yeah. And
Yeah.
it's just, and to our viewers, it's not too good to be true. It's actually true.
It's real.
Let me thank you, of course, David and Leanne, as always. Want to start having you back a little more often, David, when I do a show on long-term care insurance, when we do a show with a national in-home care provider, because whole person is, the tentacles of it are included in all of that. What you've created here is just incredible. To our audience, thank you very much. We ended the last 2 months of 2025 with close to 40,000 views, effectively making 62 Who Knew one of the largest retirement platforms in the country. And now we've added 20 to 30-year-olds, thanks to you guys. I also want to make a couple of quick announcements. Number one, we're going to do a special edition of 62 Who Knew in the next 30 days, a healthcare education edition solely for you, for a whole person. We're going to get technicians on the phone, people that actually can say, yes, I spoke to a mom in tears at 3 a.m, and this is what we did. We're going to get some employers who have done this as a group to say, let me tell you how much money we are saving because all of the people that work for us have enlisted in the other. Subscribed to this. It's going to be a 100% show on healthcare and wealth care, because that's what this is, healthcare and wealth care.
This needs to be, whole person needs to be the very first phone call, no matter what is happening, the first phone call, whether you have insurance or you don't, the first phone call, because from there you'll be able to know and be assessed and know what the next steps are.
That's exactly right. The other thing I want to announce that I'm very excited about, we have 4 shows per year, 4 shows per month, although we're going to do the special for whole person. The last show of every month we are changing. Every one of our shows is consumer facing, and we love all of you, and we're going to continue to grow. The last show of every month, I haven't decided on a name yet, but it's going to be something like 62 Who Knew, the Inside Edition. And that is going to be directed towards financial professionals, certified financial planners, independent financial advisors, healthcare people, the professionals. It's going to be inside talk of what's happening in this country and why we all need things like this. You'll be included in this, David. But the 4th show is going to be a business show. And when we market it, Anthony, it's, of course, our consumers are more than welcome to listen, but it's going to be marketed to financial planners, large groups, IFAs, 4 million insurance agents in this country. And of course, we want you to be included in that, David. But we're excited about that. 3 shows a month directly to the consumer to help them from everything from selling their house with RE/MAX, buying their new house with RE/MAX, healthcare, virtual home care, but the fourth show to the professional, to let them know all these things are available to them and their entire database of clients. So very excited about that. Our first show is going to be the last show of this month, and we will be featuring Chiefs, which has been on twice before, which is all about the fractional sale of your home equity, the fractional sale of your home equity to use to fund for retirement without having to borrow any money. That's going to be, that's going to be our first guest. So everybody, again, first show of 2026. I said I wouldn't say it again, but I will. Happy New Year. You and your family have a happy, healthy, of course, healthy and prosperous New Year. And we will see you next week. Go to the website, like, share, subscribe. Don't forget to do that because I don't say it enough. Everybody tells me. See you next week.